I look forward to the day when I don't have to operate anymore. If we get to the point where I don't have to remove a lung cancer, that means we've done something right. I am Dr. Brian Mitzman. I'm a general thoracic surgeon here at the Huntsman Cancer Institute and the University of Utah, and I specialize in robotic thoracic surgery. So there's this misconception that I hit a button and I go get a cup of coffee and the robot does all the work. Robotic-assisted surgery is essentially just like laparoscopic surgery. If you're gonna have your appendix out and the surgeon is using long instruments and a long camera, except the robot is holding those instruments. So the surgeon's still completely controlling them. We sit in this device where we can control the instruments, but we're able to see in 3D. It's 10 times magnified, and it gives us this precision where the instruments mimic our wrist movement and our hands movements. So you can do, in my mind, better surgery, more efficiently, more precisely, more complicated operations that normally we would not be able to do through tiny holes. So in my world in thoracic surgery, we really have two robots now. There's the classic robot that you hear about on TV, the Vinci, that actually is helping us do the big operations. And then we have a smaller robot called the Ion, which is helping us identify tumors, cancers that are much smaller. So for the Ion specifically, we're able to find these tiny little cancers that normally we would not be able to remove, that we would either be watching until they got bigger when they would be resectable, or if we went to remove them, we'd have to take out a much bigger piece of a patient's lung tissue. Now we can precisely see exactly where it is and take out a much smaller piece. The classic robot, the Da Vinci, in my world, it has a lot of benefit. So as you can imagine, the chest, not an easy thing to get into. The ribs are in the way. So if we want to get our hands inside, we have to make a big incision. Sometimes we have to actually break a rib, and the recovery can be quite painful. Patients are in the hospital 5 or 6 days. And it could be several months before a patient is feeling like their normal self again, going back to work and just feeling normal. With the robot, because the incisions are so much smaller, we're able to sneak in between the ribs, do the same cancer surgery we'd be able to do with a bigger incision, shorter time in the hospital, 1 or 2 days instead of 5 or 6, much less pain. When I send patients home, I tell them there's no restrictions usually. They can do anything they want to do. They just have to listen to their body. They can't damage what I did to them. So it's just listen to your body and get right back to your normal routine. So same cancer outcomes, but just a much easier recovery for the patient. During my residency, I fell in love with thoracic surgery. I was participating in cases, and just the anatomy of the chest, the way the blood vessels and the airway all are like a big Rubik's Cube. It's like a big puzzle. That really interested me. I loved the high stakes nature of the operations, but then the massive benefit you can give these patients, especially with an early stage lung cancer, where if you do a good job and catch it early, you can really cure them. What I love about thoracic surgery is that it's almost still in its infancy. We are evolving at an exponential rate here. It's so fast. 10 years ago, when I was in training or finishing my training, everything was still being done through an open incision. If we go back to 2010, 80% of lung cancer resections were through a big incision where we're breaking a rib, big operation. Now that's down to 20%. So in just 10 years, especially with the help of robotics, everything has changed. Because my field is changing so rapidly, whether it's lung cancer or esophageal cancer, our treatments are getting better, our cure rates are getting better, the technology is getting better. I love being at the Huntsman Cancer Institute because we're just on the cutting edge of all of that. We are helping the field progress faster. I look forward to the day when I don't have to operate anymore. If we get to the point where I don't have to remove a lung cancer, that means we've done something right. So that's what we're fighting for every day, is less invasive operations and eventually getting to the point where an operation isn't even necessary.